Hello. First, I want to introduce you myself. I am Dr. Nale from Kolan Hospital. I'm an associated professor on OBGYN, and also I'm an IVF specialist. I also study stem cell therapies, and I have been in the United States for stem cell applications. Okay, first, I want to give some information about infertility and infertility problems. First, I will start with defining infertility. What is infertility? How do we say to a couple if they are fertile or infertile? The inability to become pregnant after 1 year of intercourse without contraceptive methods, we think that this couple is infertile. But if the woman's age is above 35, we have to define infertility term after 6 months. Because as we all know, ovarian age is going on. There are many causes of infertility that needs to be treated. IVF is one of the treatment methods of infertility, which has the greater impact on pregnancy and live birth rates compared to other treatment options. And our center, the IVF Center, offers the most effective fertility solutions for couples with ultimate techniques and long-time experience. In this method, IVF, a complex series of procedures are used to help with fertility or prevent genetic problems. Why should I need an IVF treatment? If you have absent or blocked fallopian tubes, in this case, your oocytes and sperms cannot come together and you cannot get pregnant. If you have severe male factor infertility, if you have low sperm count, if you have low sperm motility, or if you have no sperm, you need to have IVF treatment. If you are advanced reproductive age, the time to conception is critical and pregnancy rates with other therapies are unfortunately low. If you have endometriosis, this means you could have ovulation problems and if you could have low egg number. If you have ovulation disorders and you cannot get enough answer from other treatments, IVF could be a good option for you. In 1/3 of the cases, we cannot find any common cause that needs to be treated. That's why we call these couples unexplained infertility. Also, in these cases, IVF treatment results are higher than other treatment options. And also, if treatment with other therapies are not effective, are not enough for you to get pregnant, you should try IVF treatment. And also, if you are not infertile, but you have an inherited genetic disease that you wish to avoid passing on to your child. In this case, IVF is combined with other laboratory techniques, pre-implantation, genetic diagnostic tests, and then you can have a child without the disease. This means that the embryos, we test the embryos for the disease, and only those without the disease are transferred to the uterus. If you have premature ovarian insufficiency, in case less eggs are available, you should need IVF treatment for best results. If also you need fertility preservation for cancer or other health conditions, if you're about to start cancer treatments such as radiation or chemo, that could harm your fertility, and IVF for fertility preservation is your only option maybe. Women can have eggs harvested from their ovaries and freeze them in an unfertilized state for later use, or the eggs can be fertilized and frozen as embryos for future use after the treatment. Let's see what steps you are waiting during IVF treatment. The IVF procedure consists of several steps that take place over a period of weeks. Stimulation of the ovaries to produce several ovarian follicles, each of which contains an egg during ovarian stimulation. Normally, if you don't have any treatment, you can have only 1 egg per month. But with IVF treatment, we increase the number of eggs that we can collect during this treatment to increase our chance for pregnancy. And after ovarian stimulation, we will retrieve your eggs from the ovaries and obtaining a semen sample, and fertilization of the eggs with sperm and growth of the embryos in the laboratory, and transfer 1 or more embryos to the uterus after that. First, let's talk about ovarian stimulation. The first step of the IVF procedure generally involves the use of fertility medications to increase the number of eggs follicles that develop in the ovaries and control the time of ovulation. The stimulation regime is selected based upon the woman's diagnosis and the IVF center's protocols. It's also possible to perform IVF without ovarian stimulation. This is known as natural cycle IVF or unstimulated IVF or modified natural cycle IVF. Usually only 1 or 2 eggs is retrieved. However, the vast majority of IVF cycles worldwide are performed with some type of ovarian stimulation because natural cycle IVF is associated with lower pregnancy rates and less drugs consumption. The ovarian stimulation regime described is an example and may differ from that recommended by your doctor because it will be decided according to your situation, according to your ovaries, number of your eggs, and semen sample. Many clinicians will prescribe maybe before treatment a birth control pill for the woman to take for 1 or more weeks before beginning IVF. This pill helps to prevent the woman's body from releasing hormones that could stimulate natural ovulation and that could interfere negatively with our treatment. Most programs ask that you call on the first or second day of the menstrual bleeding to schedule an appointment for blood tests and an ultrasound. The first day of menstrual bleeding is considered the first day of the cycle. On the day 3 to 5, you may be asked to have a pelvic ultrasound to evaluate your ovaries and blood testing to measure hormone levels. If these tests are okay, you will be given a date to start giving yourself injection with FSH to stimulate the growth of egg follicles. In most cases, you will give yourself an injection of FSH once per day, generally in the evening. The injection can usually be given under the skin rather than deep into the muscle. That makes it painless instead of painful. After a few days of injection, you will be asked to have a pelvic ultrasound to measure follicle growth and a blood test to measure hormone levels. Depending upon the results of these tests, the dose of FSH may be increased or decreased. Blood testing and pelvic ultrasound may be repeated several times during a cycle. The goal of stimulation is to have at least 2 follicles that are approximately 15 to 18 millimeters in size. The number of follicles that develops depends on the ovaries and hormone levels of the individual patient. In most cases, more than 2 follicles develop. In some cases, more than 20 may develop. When blood testing and ultrasound measurements show that the follicles are ready, you will be instructed to give an injection of HCG to trigger ovulation. HCG is usually injected under the skin at a particular time in the evening. This allows the follicles to be ready for egg retrieval and also for fertilization during a window of time, approximately 36 hours later. Egg retrieval. Approximately 32 to 36 hours after injection HCG, a procedure is performed to retrieve the eggs. The physician inserts an ultrasound probe into the vagina and then uses a needle to withdraw the egg from each follicle with a very special technique. The procedure takes approximately 15 to 30 minutes, depending upon how many follicles are present, and is performed under conscious sedation, light anesthesia. Serious complications of oocyte retrieval are uncommon, which makes this procedure safe. But side effects such as pelvic cramping, light bleeding, and vaginal discharge often occurs. If these problems are persistent or become severe, it's important to call a healthcare provider as soon as possible. Embryo transfer. Approximately 2 to 5 days after the retrieval, 1 or more eggs that have been fertilized, embryos are placed in the woman's uterus using a thin, flexible catheter inserted through the cervix. Most commonly, embryo transfer is performed on day 3 or day 5 after egg retrieval. The soft plastic catheter is inserted as gently as possible to minimize uterine cramping. Anesthesia is not usually needed for this procedure. Following the transfer procedure, the woman is generally encouraged to rest at home for several hours. Progesterone medication could be prescribed to improve the chances that embryo will implant and attach inside the uterus. This medication is started either on the day of retrieval or the day of the transfer. There are several ways to administer progesterone, with the most common being a vaginal gel or suppository, or an injection given into a muscle. What do we do in lab? Fertilization. We perform in vitro fertilization. After the retrieval procedure, the eggs are combined with sperm in a laboratory, so they will fertilize. There are some techniques that we use for optimizing the fertilization. One of them is classical in vitro fertilization method and intracytoplasmic sperm injection, or IMSI. Conventional technique, in vitro fertilization method, the mature egg is placed in a laboratory dish with some of the sperm sample, and they are left for 16 to 18 hours within the incubator, and then monitored under a microscope to see if fertilization has taken place. ICSI method, intracytoplasmic sperm injection. In this method, once the eggs are removed, each egg is placed under the microscope and a single sperm selected, which is supposed to be the best looking sperm, is micro-injected by the embryologist into the mature egg. Currently, this is the preferred technique as it maximizes the chances of fertilization. The eggs are left within the incubator, and 16 to 18 hours after the micro-injection, the eggs are monitored to see if fertilization has taken place. What do we do if there is no sperm? The term azoospermia means there is no sperm for fertilization. For such cases, we use TESE or micro-TESE procedure. What is TESE procedure? TESE is a surgical procedure carried out by a urologist or andrologist. It's usually performed under general anesthesia, and the acquired samples taken from testicles is examined in the operation room. If the embryologist decides that the sample is a viable sperm sample and enough for the procedure, operation will stop and the samples are sent to the laboratory for fertilization. What is micro-TESE? Microscopic or microdissection testicular sperm extraction is a surgical procedure performed in the operating room under general anesthesia to retrieve sperm for IVF or fertilization by using operative microscope. Microdissection TESE can improve sperm retrieval for men with non-obstructive azoospermia over those achieved previously with standard testis biopsy techniques. The main difference between TESE and microdissection TESE is that the micro-TESE process is performed by using the microscope to get optimal sperm sample. The urologist may distinguish sperm production more easily in the centers called tubules by magnification under the microscope. In this way, both the chance of finding sperm will be increased and the damage to the remaining testicle tissue will be minimized. There are high sperm retrieval rates with a micro-TESE, approximately 50 to 55%, except in some cases where large fragmentation and Sertoli cell only occur in some Y chromosomes where sperm production is not or seriously affected. What do we do in the lab again? We may perform oocyte freezing instead of embryo freezing. It's statistically proven that getting pregnant after the age of 35 is harder. Miscarriage rates are higher at older ages with older eggs. Women can freeze their eggs when they are still viable and in good quality. So if they wish to get pregnant at a later age and have poor egg quality, they will have the frozen eggs as a backup plan. With this method, you can conceive at the age of 40, for example, with your eggs collected from the age of 30 years, and you will have a higher pregnancy chance with the higher quality of a 30-year-old egg. Egg collection is not only for women who want to postpone gestational age, but also for women who have reduced or decreased egg capacity for medical reasons. There are some tests we can perform before transferring the embryo, before potential implantation. Advances in genetics and IVF laboratories now enable us to evaluate each embryo and whether they carry out the correct number of chromosomes and if they carry out normal arrangement of the genes to indicate they are healthy. It can also be used to identify a specific genetic mutation. We may do some tests which will give us the optimum results. FISH, RACGH, and NGS, next generation sequencing, are one of them. In this method, this is earliest known genetic methods of investigation. It focuses on the study of a single cell called the nucleus, which carries the genetic information. In RACGH is a method that allows the examination on the genetic structure of an embryo. The biggest advantage of the test is that it allows the evaluation of all chromosomes either numerically or structurally. NGS is the ultimate test. This treatment and biopsy technique and timing for NGS is the same as RACGH. In cases where NGS is used, and embryos are frozen individually after embryo biopsy. If a suitable healthy embryo is found after the result, the transfer again will be carried out in a later cycle. Why you should choose our department or hospital? First, experience. We have 500 cycles to 2,000 cycles per year. And also we have a multidisciplinary team with perfect collaboration. We are a team with 3 IVF certified doctors. We are males and female doctors, and one of our clinicians has stem cell education experience in the United States. We have 2 very good experienced doctors, urology doctors, and we have 2 embryologists, approximately 15 years experience, and 4 nurses, whom they will help you as soon as you want. We all understand about your journey and how you could feel going through this period. Some of us also experienced this. We will be here from the very first moment through your treatment period. We will evaluate every detail and every improvement according to current scientific developments and with our vast experience. Our approach will be personalized due to your needs, clinical status, and will target the optimal results for you. We have high success rates and we have really good experience, and we have 70 to 75 pregnancy rates and 58 to 61% of retrievals, which is a very high number, resulting in live births. Embryo development is critical to the fertility success to those who have experienced a miscarriage, failed IVF attempts, age-related issues. Oocyte freezing techniques is also decisive for those who want to preserve fertility according to medical reasons, such as before chemo and radiation therapy. Our highly experienced embryology team and laboratory facilities will come over all the pitfalls that could prevent you from hugging your baby. Advanced genetic tests will improve pregnancy rates by helping us to choose the best embryo for you. Our highly experienced embryology team and laboratory facilities will come over all the pitfalls. Our surgical experience. Our team members all are highly skilled for surgical procedures. Laparoscopy and hysteroscopies are all available options to improve our success. Fibroids, uterine anomalies, polyps, or endometriosis will not be an obstacle anymore. Facilities in our operation room are all worldwide quality. These advantages will make you closer to your baby with us. And also ultimate options for you, stem cell therapies. As we all know, stem cells are undifferentiated cells that exist in embryos, fetuses, and adults to produce differentiated cells. Stem cells have incredible capacities to regenerate and support tissues. For female infertility, stem cells are used for ovarian regeneration and oocyte generation in cases of early menopause. Live births are achieved with stem cell therapy. Stem cell therapies are all available in our clinic. Diet adjustments, psychological supports, and acupuncture treatments that could increase your chance and make you more comfortable during our treatment will all be available for you. And also, I want to add one more thing. Please do not hesitate to contact with us in any question, any concerns, or anything that's important for you. Please do not hesitate. Just text us. Thank you so much for your patience.